The opinions and statements expressed in the following program do not necessarily reflect those of WWDB, its staff, or management.
Good day, everyone. Welcome again to another edition of Boomer Generation Radio, coming to you live from the studios of WWDB AM 860 here in the Delaware Valley. This is your host, Richard Address, welcoming you to another edition of Boomer Generation. This portion of Boomer Generation Radio brought to you by the Kendal Corporation, a not-for-profit system of communities and services located in 8 states in the Northeast, the Mid-Atlantic, and the near Midwest regions of the United States. Kendal advocates for and empowers older adults to reach their full potential and is committed to working with others to together transform the experience of aging. And to learn more about Kendal, that's Kendal, we invite you to visit kendal.org or call toll-free at 888-759-0128. That's 888-759-0128. And hopefully on the line now with us to begin our second segment is Ruth Bish and Karen Russell. And are you there, ladies?
Yes, we are.
Hey, very good. I'm always amazed that technology works.
Hey.
Thank you very much. Thank you for Tony for organizing the great technology gods who are sometimes a fickle group, as we know. Ruth Bish, Regional Director for the Pennsylvania Restraint Reduction Initiative, and also Regional Director Karen Russell for Pennsylvania Restraint Reduction Initiative, and representing also Kendal Outreach, if I'm not mistaken.
That's correct.
So welcome, Karen, welcome, Ruth, to Boomer Generation Radio. And I have to start because I'm not familiar with this at all. Could you talk to us about what this Pennsylvania Restraint Reduction Initiative is? It sounds very strange.
Well, we always say we need a new name for our project, but the Pennsylvania Restraint Reduction Initiative is a grant-funded project that started in Pennsylvania in 1996. Originally, it was designed as a 2-year project to see if efforts could be made to eliminate the use of physical restraints in several long-term care facilities that were part of what was the first 2-year grant that was awarded. It was through the success of that first 2 years that very, very thankfully and gratefully that grant has continued in the state and has allowed us the opportunity to greatly expand the work that we do. Kendal Outreach oversees that we call it PERI, the Pennsylvania Restraint Reduction Initiative. Kendal Outreach oversees that grant, and that's probably the briefest explanation. It's a specific grant. We work only with skilled nursing homes, nursing facilities in Pennsylvania. That allows us to be a free resource to Pennsylvania's nursing homes.
So let me get this right, because a lot of us, clergy like myself who have visited people, and we'll walk into a nursing home sometimes and see people in restraints, which always, that when first time you see it can be shocking. And, you talk to people and say, well, this is for their own benefit, because if not, they'll potentially hurt themselves. So what I'm hearing you say is this program is designed to eliminate those restraints. Is that correct? Am I understanding you correctly?
Yes. There are a lot of misperceptions about the use of restraints. And over the last 18 years, as Kendal and PERI have been working on restraint reduction, Pennsylvania, when we started, had a rate of about 28% of the nursing home residents at that time were physically restrained. That number today is less than 2% in Pennsylvania. So we've been able to make a huge impact in the state.
Say that again. I want to make sure I heard that correctly. Are you telling me that when this thing began, 28% of nursing home residents in the state of Pennsylvania were under restraint?
Yeah, correct. A lot of seat belts, vest restraints, a lot of different types. And so through our work and other organizations, we've been able to do a lot of education, work hands-on with nursing homes, and that rate, like I said, is now under 2% in Pennsylvania. So as a result of that, we have expanded to deal with some of the issues that may lead to the use of restraints. We work a lot with falls, behavior management, that type of thing, but also pressure ulcers, because pressure ulcers are one of the negative outcomes of using restraints.
What is so for us lay people, what is a pressure ulcer?
Good question.
Yeah, well, go ahead.
A pressure ulcer, a lot of lay people will know it as a bed sore.
Oh, okay.
Cubitus ulcer. It's basically what happens when there's injury to the skin from prolonged pressure that reduces the circulation to the tissues, and the tissues end up dying and forming this sore or this ulcer. They are, for the most part, preventable, and it's become a big issue in healthcare today because of that. There's a lot of cost involved. There's a lot of consequences to the person who has one. It affects them on a physical basis with pain and discomfort and limitations.
They're at risk for infection if they develop a pressure ulcer. Oftentimes, if somebody has a pressure ulcer, part of the treatment is to keep them in bed for longer periods to allow it to heal, because oftentimes pressure ulcers occur over a bony prominence. That's usually how it happens, and that's because they sat too long in one position or they were laying too long in one position. And when that blood flow is interrupted because they haven't been moved frequently enough, that's where the damage occurs. And so to heal it, that means you have to keep them off of the area. And so, if they have to spend longer periods in bed in their room, other things that we see happen is that they're isolated for a large amount of the hours during the day. They may become depressed. So pressure ulcers are a big issue related to the individual who has to endure having one. And then there's also other related issues, the effect on financial burden on the part of the provider, reimbursement from insurances, including Medicare and Medicaid, have been impacted. Because Ruth said, these are considered something that is preventable. Mm-hmm. And so insurers don't want to reimburse, in many cases, to pay for them to become healed. So the financial burden on the part of the provider has increased significantly. And in turn, there are all kind of outcomes here. May affect the provider's reputation in the community. I mean, for example, if hospitals, data's collected, they have to report these things. Nursing homes have to report, and they are graded against each other. If it looks like you're an organization that has a high incidence of pressure ulcers, occurring in your setting, that's not good for, your reputation.
But let me ask you a question.
Sure.
Suppose a patient just is acting out or has a potential for violence, or there's a reaction, and I'm not a doctor by any stretch of the imagination, reaction to medication and sometimes needs some sort of restraint. I mean, there are legitimate reasons, are there not, for the use of restraints in certain circumstances, or are you saying that there are no reasons at all for restraints to be used?
We're saying that in our work, and this is over 18 years of work, mm-hmm. It has been extremely rare when we haven't encountered a situation where a person used a restraint. See, here's the issue. How the restraint treats that medical symptom or condition. Because somebody might fall or even has had some falls, or because somebody has a challenging behavior, does not fall under the criteria for restraint use. Restraint use is very specific when and if it's ever appropriate, based on perhaps where a person might be in a certain specific type of disease condition. And I'll give you an example.
Right.
Unfortunately, over the years, we've met some individuals who have a disease called Huntington's chorea. And Huntington's chorea is a very mean disease in that it basically causes uncontrollable, unpredictable movements. And I have had the opportunity to maybe meet a half a dozen people who have this disease. And based on where they are in their process, if they can't get out of a mattress on, out of the bed and participate in life without a restraint, then, because the restraint in that case allows them to stay in a chair, which allows them then maybe to go outside, go to a dining room, go to the barber shop or the beauty shop, then in that way, perhaps for that particular individual and where they are in that disease process might be an appropriate use of a physical restraint, because it's actually part of their plan of care for treating their disease. But what has happened is people have used restraints because something bad might happen, or because somebody might fall, or she's 93, she might fall. What we do is work with staff, and have done for all these years, to teach them better ways. There are better ways that we can keep people safe without having to make such an impact on their overall quality of life. I don't want to spend my days, behind a seat belt or whatever unnecessarily, and that's the difference. There may be a small 1% of people, based on where they are in their physical condition, that might get a benefit for a period of time for restraint use, but overall, no.
All right, so I want to pursue this a little bit because there are a lot of people who may be listening who have a parent in a facility, and they may have a conversation very, very soon with some of the people in those facilities, and walk in there and see a mom or dad under restraint, or having restraints used upon them, and the facility will say, well, this is for their protection, we don't want them to fall. You certainly don't want to have a situation where mom or dad falls and breaks a hip, etc. And you're saying there are other. What are some of those other ways that a family could dialogue with a facility to short circuit the use of restraints on a loved one?
Well, that's a big question, because usually what happens is it's the families that have, over the years, it's our fault. It's the fault of healthcare providers that we have kind of trained the public to think, the misperception that if we put a restraint on somebody, they'll be safe. But research throughout the years has proven just the opposite. Especially individuals with dementia who have periods of confusion during the day or disorientation, they are at the highest risk for negative outcomes related to restraint use. So to start a dialogue, I think we have to, as the provider, when somebody's looking at us or they have a family member living with us, we have to start to provide them education so that they can see that we want to keep a restraint-free environment, and these are the ways that we're going to do it. And it can be through a lot of avenues. A lot of people are over-medicated. Some people need to go through strengthening programs. Some people are just plain old bored all day long, and so when I'm bored, I'm going to get myself in situations because I'm going to create my own entertainment. And part of that entertainment might be that I'm going to start rummaging through other people's drawers, or I'm going to stand up because I don't remember that I need help to stand up, and I don't have anything to do, and there's nobody paying attention to me. So a lot of what we do is education-based for the providers, for family members, for the residents themselves. I don't know if I answered your question.
Well, yes and no. What I'm hearing also is there's a lot of information that just needs to be distributed and made known to families who, when you, as you know, you work in these facilities and families are often at a loss for, it's so overwhelming of what's happening to a loved one that they may not know the questions to ask. And there, as you were saying, there's the medical. It's just intimidating sometimes to walk into a place and know that that's your mom or your dad, and you're concerned, and yet you don't know what to ask. When we're starting to actually even run out of time, I just want to remind the audience that you're listening to Boomer Generation Radio here on WWDB AM 860 in the greater Philadelphia area, and we're speaking with Ruth Bish, Pennsylvania Restraint Reduction Initiative Regional Director, and Karen Russell, also a Pennsylvania Restraint Reduction Initiative Director, and also representing Kendal Outreach. Karen, let me jump in here too, because this is the segment, the half hour of Boomer Generation, brought to you by the Kendal Corporation, and you work in Kendal Outreach, correct?
Correct.
And so this program is been funded through Kendal Outreach, correct?
If you're referring to the Pennsylvania Restraint Reduction Initiative, is that what you...
Yes.
The Pennsylvania Restraint Reduction Initiative is currently funded by the Department of Public Welfare in Pennsylvania through a grant. We have been awarded a grant from them.
So go ahead.
Let me explain that grant money. The grant money that we get from the Department of Public Welfare is actually civil penalty money. That's money that nursing homes in Pennsylvania have had to pay back through their survey process when they have poor performance. Sometimes they have financial penalties. And so over the years, that money has been collected. And now we get a portion of that money to be funded for projects such as the Pennsylvania Restraint Reduction Initiative and our Map It project. So it kind of, in turn, is a way of reinvesting that money to make us available as a resource to Pennsylvania's nursing homes so that we can help them improve their care processes.
So does Kendal Outreach, how does Kendal Outreach impact the distribution of this information to all the nursing homes in Pennsylvania?
Well, the grant is awarded. The grant from the Department of Public Welfare was awarded to Kendal Outreach, so Kendal Outreach oversees the grant work. Okay.
And Kendal Outreach, real fast, is what? Give me a couple of sentence explanation of Kendal Outreach.
We are the arm of the Kendal Corporation, based in Kennett Square, Pennsylvania, that makes ourselves available to the underserved population in Pennsylvania's nursing homes, to bring Kendal values out to people who don't have the opportunity to live in a Kendal setting.
So this is literally outreach to those individuals who aren't in a Kendal facility and bringing your information to them. Is that correct?
Correct. We will go into any nursing home in Pennsylvania that requests our help, and we do that because of the grant without charge. So we do a lot of education in facilities. We do statewide education programs for nursing home staff. We sometimes meet with family groups or other groups, any venue that we can find to educate the public about what we do and care can be improved in nursing homes. We're all about improving the process to improve the quality of care for the elderly.
So if somebody who is listening to this and may be associated with a facility in the state of Pennsylvania, they wanted to avail themselves of this information, how do they do that? Do they call you? Do they go to a website? How do they do that?
They can go to our website, which is www.kendaloutreach.org, and there is only one L in Kendal.
Right.
Or they can call the main office, which is 610-335-1281, and speak to the director, Beryl Goldman. She will determine who the appropriate person is in the state to talk to that facility. We have 5 regional directors across the state, and so we each kind of have territories that we cover.
Right. So, and this is, just for clarity, this is, as of now, specific to Pennsylvania. Is that correct?
Correct.
All right. So give us the phone numbers. So if there's somebody listening or hears about this and from a facility somewhere in the state of Pennsylvania, and there are many, many of them, and even if they're not affiliated with Kendal officially, they want to participate in and getting this information about the Restraint Reduction Initiative, they get that information again how?
They can either go to the website, which again is www.kendaloutreach.org, or they can call our director, Beryl Goldman, at 610-335-1281, and she would connect them with the right regional director.
So you mentioned this other project that you're involved with, Ruth and Karen, this Map It for Healthy Skin. What is that? How does that relate to the Restraint Reduction Program?
Well, as Ruth mentioned earlier, there are a lot of negative outcomes related to restraint use, and over the years we've tried to address and begin working on those areas. Fall management, fall prevention, I guess, is one big area that we've undertaken. Behavior management, working with residents with challenging behaviors, and pressure ulcers, as we described earlier, is another negative outcome from using physical restraints. And so we became involved in the idea of developing this PA, it's called PA Map It for Healthy Skin, and that came about when administrators from CMS, Region 3, CMS's Centers for Medicare and Medicaid Services, actually in 2010 approached our director, Beryl Goldman, to ask if there was, a possibility that prevention of pressure ulcers would be another area that the outreach group could begin to work on. And so in 2010, we had a meeting of interested stakeholders, different people from the Pennsylvania Hospital Association, of course, Kendal. We had wound specialists, people from with nursing education backgrounds who had wound care specialty. So we kind of brainstormed to see what could we do that would be a different-looking project to help to impact this, what was not very impressive rate as far as pressure ulcers in Pennsylvania. Ruth mentioned that at one time, related to physical restraint use, we had over 28% of our residents restrained physically. Well, our Pennsylvania's rate of pressure ulcers acquired when people were in healthcare settings was equally not very impressive. That's why the push was on to see if we could do something different. So we actually formed what we're calling continuing care groups we have two established in the state. One is in Abington, Pennsylvania, and the other one is in Johnstown, Pennsylvania. And each of these care continuums consists of one acute facility, which is a hospital, and then we have home health care providers, we have skilled nursing homes, we have personal care homes, and we also have wound clinics involved. And basically, it's within their own a smaller geographical area.
Okay, I hate to do this to you, but we are banged up out of time. So I want to thank Karen Russell and Ruth Bish, Kendal Outreach, and representing the Pennsylvania Restraint Reduction Initiative. Thank you very much. For all of us at Boomer Generation Radio, thank you for listening. See you next week.